Come in.
Hi, my name is Michael. I'm gonna be your student nurse today. Are you in any pain at all? Do you have any like hoarseness when you cough? Do you have dry throat? Any like weird looking snot?
No.
Good here. Can you go ahead and say your name and date of birth for me, please?
Emma Cooey, 62703.
So my patient is upright. She's tan and pink in color. She is conversive, looks her stated age, dressed for the occasion. Today we're going to be doing a nose, throat, mouth exam. So that's going to include me kind of looking around, inspecting you, going inside your mouth with a little tongue depressor, and yeah, is that okay with you today? Okay, good to hear. So very first thing I'm going to do, I'm going to inspect your nose. Okay, her nose is symmetrical with no lesions or masses or like humps or deformities. She has no acne on there, no like nose piercings. Next up, I'm going to ask you to, can you cover your right nostril? Okay, and then blow out of your left. Just like breathe through it. Okay, is that hard at all?
No.
Good, and then switch and try it again. Nice. Was there any pain or anything?
No.
Nice. So, her nares are patent, meaning they're open. Next up, can you please tilt your head back just a little bit? I'm going to inspect your nostrils. Nice. Nice. Okay, so there's no deviation, no like deviated septum. Her nostrils are pink, they're clear. There was no like snot coming out, like no discharge. I forgot the word for that one. No boogers? No. Yeah, not sure. So next up I'm going to feel your sinuses. So may you please take off your glasses. So first I'm going to check your frontal sinus. So I'm going to go. Any pain at all? For your cheekbones. Pain?
No.
Okay. So there was no pain when I checked her sinuses. I did frontal and maxillary. There was no like swelling or anything. Don't really know what else you speak to with that one. Next up, may you please smile really big for me?
Yeah, I'm sorry.
It's okay. Like really big. Yeah, like that. Oh. Alright, so her teeth are white. They align like top and bottom. She has no missing teeth. Can you open up real quick? Oh, and she has a little retainer on the bottom, a permanent retainer. So there, no, that's up to it. So retainer and then, oof. I'm not really sure what else I speak to. Next up, may you please open your mouth really wide and say ah. Awesome. So the uvula moved and moved up during phonation. I'm going to look a little bit more in just a second, but her pharyngeal wall was clear of any like drainage. It was like pink in color. It was moist. Her entire mouth was moist. I'll say that. Her tonsils were not swollen or like they weren't leaving anything out. But next I'm going to look at your buccal mucosa, your gums, your hard and soft palate, etc. So maybe please open up your mouth again. Okay. Awesome. And then can you bring your tongue down like a little? Nice. Okay, sorry. So there were no lesions on her buccal mucosa, like cuts, sores, or piercings. Same with her tongue, there were no piercings on there. Her hard palate was like pink, and like it looked pretty rigid, and her soft palate moved up a little when she opened her mouth wide, and it was white, it was moist, it looked moist. Her gums had a defined, it was a defined gum line, again moist. I saw no lesions or masses. Lesions would be like a sore in her mouth. No masses in her mouth, like a, starts with P. I don't know, I forgot the name. But like no like weird growths. Yeah, I think that's it. And then after that, her lips are red and pink in color. They do not look chapped. Oh boy. They look moist, kind of. Like they, yeah, just don't look chapped. No lesions on there, that's what I was missing. No lesions like piercing or like cuts on her lips. And can you stick out your tongue for me? Okay, her tongue is pink, moist, and has no like piercings or cuts on it. Is there anything else I can get you today?
No.
Good to hear. Thank you.